Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha, you're watching Healthy India. In the Union Budget for 2023-24, the health sector has been allocated 89,155 crore rupees, a hike of around 13% against the allocation made in the previous budget in 2022-23. Among other key announcements for the health sector, Finance Minister Nirmala Sitharaman said 157 new nursing colleges will be established in co-location with the existing 157 medical colleges which have been established in the country since 2014. Also, a mission to eliminate sickle cell anemia by 2047 will be launched. Facilities in select Indian Council of Medical Research laboratories will be made available for research by public and private medical college faculty members and private sector research and development teams for encouraging collaborative research and innovation. Also, from the new financial year, the Pradhan Mantri Swasthya Suraksha Yojana has been divided into two sub-schemes, the first being the PMSSY itself, and the second one is the establishment expenditure of 22 new All India Institute of Medical Sciences, for which 6,835 crore rupees have been allocated. So we'll talk about these new initiatives announced in the Union Budget and how beneficial will they be for the health sector on this edition of the program. Pleased to have two special guests with us in the studio. Dr. D.K. Gupta, he's a member, Health Committee Assocham, and he's also the Chairman and Managing Director, Felix Healthcare Private Limited. Dr. Gupta, thank you for joining us on Sansad TV. And Dr. Rajiv Das Gupta, he's Professor, Center of Social Medicine and Community Health, JNU. Dr. Das Gupta, thank you very much for joining us on the program as well. Let me begin the program with you, Dr. Das Gupta. First, coming to the allocations. So what we see as per government numbers, a 13% increase in allocations. Does it say that the country is now COVID negative, the health budget of the country is COVID negative, and now we are prioritizing growth in the real sense?
Yes, the fact is that India responded quite significantly to the challenge that COVID posed, both in terms of providing medical care as well as later in the phase of vaccination. However, as those needs have in a sense been met largely, what we see is focus now shifted to programs such as sickle cell anemia, to strengthening some of the human resource aspects such as the nursing colleges.
Right.
But yes, this is a health budget which doesn't really demonstrate a paradigm shift that one may have expected given the experience of the COVID, plus some of the focus areas in the ongoing G20 programs and discourse. And perhaps a certain amount of spark needs to be there to ignite the health budget a bit more than what we have seen.
Sure. So we'll come to the new initiatives and the human resource aspect that the Finance Minister has announced in just a bit. But Dr. Gupta, is that what you also feel in terms of the allocations? Is it nominal? Could the government, and given our experience of COVID, it was unprecedented and mostly the vulnerable population, came under it. The fact is that we could expect the government to come in more aggressively into the health sector?
I think we should be more aggressive because we know that WHO norms, as per WHO norms, we should spend about 5% of GDP on healthcare. And currently we are spending around 2.1% of our GDP, 2.1 to 2.2. And BRICS countries, except India, they are also investing more than 5%. Even developed countries, they are investing more than 10%. So I think government is also planning, they are very ambitious, they are planning to invest 2.5% of the GDP from 2025. Last governments for last 70 years, they were investing around 1.1% only of the GDP. This government, in last 8 years, they have doubled their GDP expenditure on healthcare from 1.2 to 2.2. But seeing all these problems like pandemic, COVID pandemic, infectious disease pandemic, and also there is a non-communicable pandemic of diabetes, hypertension, heart attacks, heart diseases, cancer. I think we should be more aggressive. We should invest more. We were expecting around 25 to 30% of the hike from previous one. Even previous budget was also 86,000 something, but the modified budget was around 73 or 74,000 crore only. So from previous budget, we see the hike that is around only 3 to 4% only. And out of this 89,000 some crore, around 3,000 crore go on research. So actually, the budget for family health and family welfare is around 86,000 crore, means around 3% hike. And we know that this Mangai, this is also more than 5.5. So I think government should be more aggressive, and maybe I think because we have fought very successfully with the COVID, and there was priority for last 2 years on COVID only, health only. Now government is maybe willingly they have decided to not invest much on this healthcare budget.
So, Dr. Dasgupta, the question here is, we have an added challenge. We will be the most populous country anytime. I mean, officially it's not been announced, but a lot of reports are saying that we could have perhaps superseded China as the most populous country. So, given that challenge, even though it's going to be a young population, we need not have, a scenario where an unprecedented challenge like the COVID pandemic, strikes and the healthcare sector comes to its knees. So, we have to be prepared. We have to, enable our healthcare systems to be much more resilient to tackle such kind of unprecedented challenges. So towards that aspect, the allocation aspect perhaps does not meet the expectations. But as far as research goes, because the COVID pandemic also taught us the importance and the significance of indigenous research, local solutions to the local problems. So towards the area of healthcare sector research, do you think the allocation is significant?
Yes, the government has certainly made a commitment to research. So one of the things, for example, is investing in pharmaceutical research, both to cater to domestic needs as well as oriented towards exports. At the same time, given some of the recent unfortunate developments or incidents rather in drugs which have been exported, as has been pointed out, that the allocation for drug inspection or the drug regulatory apparatus, that has actually declined. So there are some of possible internal consistencies that need to be looked at in greater detail. But yes, the government has certainly made its mandate for research quite clear.
Dr. Gupta, the allocation for National Digital Health Mission has surprisingly seen kind of a double digit, in fact it's doubled from 140 to nearly around 341. So what do you think the government is trying to signal through this? The fact that digitization is the way to go ahead, and this is something that is going to be helping the government in meeting its goal of reaching the last mile?
I think that is one of the best thing government is doing right now. From the past 5 years also, they have established National Health Digital Mission, and they are going to digitalize each and every citizen's data on one single platform. And everybody, like those are the stakeholders like patient, doctor, hospital, they can access data from these sites, and they can definitely upload all the medical history, surgical history, past history, family history, even the risk factor, so that the data is at one point of contact, single click away for the treating doctor, for the patient, for the hospital, so that they can take a judicious decision. Even by the help of AI and machine learning, we can use this data in many ways for the prevention of the disease. But government is not focusing on right now prevention of disease, because we have a lot of burden of disease, those need like infectious disease, and also we have a lot of 50% of disease are more than non-infectious disease. We have future pandemic of non-infectious disease like cancer, diabetes, hypertension, heart attacks. To definitely cope up with these problems, government should invest on digital transformation, even for the AI, machine learning, so that the risk factors, lifestyle of the population can be changed. We all know prevention is better than cure. If we change the lifestyle or if we change the risk factor, modify the risk factor, definitely the chances of having disease will be less.
Towards changing the lifestyle, Dr. Dasgupta, the government has put a lot of thrust on the use of millets. So this is something that we had been doing earlier also, but due to our changes in lifestyles, we somehow left behind millets and went towards adapting other kinds of food items. Now, the thrust of this government is, and through doing it at international levels also, 2023 has been recognized as the International Year of Millets. The challenges are huge given the fact that A, we've moved on from the millet era. Number two, the storage, ability and the durability of the millets. So how are we going to bring back that kind of awareness about it being healthy for our body and healthy for the environment also?
The focus on coarse grains is of course more than welcome. It has been more than due, and over the last several years there has been an increasing focus on coarse grains, millets, etc. The point is that one millets is not going to transform the NCD scenario. NCDs, or rather the rise in NCDs, is an outcome of a range of determinants. Therefore, the medical intervention or just one dietary intervention is one of them or a few of them. In general, the allocations on social sector haven't received that much attention as one would imagine for, as you very rightly said, the most populous country in the world. And it's really attention to the overall nutrition programs, the Poshan Mission, the government's emphasis on Anemia Mukt Bharat, addressing iron deficiency anemia and other nutritional and non-nutritional causes of anemia. All of these have a bearing on healthier outcomes, including reduction of non-communicable diseases. But yes, for management of non-communicable diseases, which, as Dr. Gupta is pointing out, rightly is quite a current matter of worry for health planners and policymakers. On one hand, the emphasis has been on tertiary care, on setting up another 22 AIIMS-like institutions, etc. But read that with the ongoing weaknesses or deficiencies in the primary healthcare system, where the last rural health statistics report shows you that still 1/5 of primary health centers are without doctors and 2/3 of community health centers are without specialists. So we need to pay attention to both the ends of the spectrum.
Absolutely. So where is the challenge, when you say, Dr. Gupta, the fact that there is a shortage of manpower in the healthcare sector, there has been an attempt to increase nursing colleges to have more nurses. But the question is, how do we also ensure that this talent remains within the country? The major concern, I think, here is a lot of potential doctors from India, practice here for a limited period of time and then they go abroad, they serve in other countries. So our own population is deprived of the best kind of doctors and the best kind of medical professionals. So that is also a challenge. How do we ensure that they remain within the country, serve their own people?
I think you're absolutely correct, but now the trend is changing and the people, those who have even gone outside, this is a brain drain actually from the India to the outside, especially in the medical field. Now they are coming back to serve India. And definitely, if we see the ratio of the doctors and nurses in the population, that is improving. If we talk about the doctors, we are having 1 doctor per 854 or 857 population. As per WHO, it should be 1 per 1000. It is better. But problem is that the ratio is pan-India, it is calculated. If we talk about the tier 2 and tier 3 cities, the ratio is reversed. There is a poor ratio. If we talk about nurses, we are having 1 nurse over 657 of the population. As per WHO guidelines, it should be 1 per 300. With this help of opening of new nursing colleges, 157 nursing colleges, I think it will be also better. And we have seen the acute or crucial deficiency of nurses during COVID pandemic also. I think government should do not on nurses, other paramedical staff also, so that the shortage of skilled or trained manpower in healthcare should be less or it should be eliminated ideally, so that it should be affordable to each and everybody. Currently, around 62%, before 3 years, around 62% of the people were investing out of pocket for their treatment. They were selling their houses, they were taking loans. Now, during this government regime, it has decreased from 62 to 48%. It is a great move. But still, if we talk about this mota anaj or coarse, then I would like to one point,
yes,
like
please go ahead.
ragi and bajra and there are kuttu, there are few. This is a superfood actually. It is quite healthy and it has lots of soluble fibers also. And government is going to set up a research center in Hyderabad and they are promoting it not in India, and globally we will promote it. It will help people from prevention of disease like diabetes, hypertension, heart disease. It will help in digestion. It will improve our good lipid and it decrease the triglyceride and cholesterol. It will also improve our immunity, like fighting against the disease. So I think this is a good move also regarding this coarse grains.
And I think at the same time, we also have to increase awareness about its benefits so that people actually make it a part of their daily lives. Moving on to the other announcement, Dr. Dasgupta, is one of the missions that the Finance Minister announced to tackle sickle cell anemia by 2047. Help us, understand about how grave the problem is around sickle cell anemia, and through this mission, Is the government trying to, signal its commitment to prioritize the health needs of especially the most vulnerable people?
Yes, this is absolutely a very important announcement, a very important marker of the government's resolve to address anemia as a whole. Now, anemia ordinarily is understood simply as iron deficiency anemia, which it is not, or which it is entirely not. Among the non-nutritional causes of anemia, hemoglobinopathies, which is disorders of the hemoglobin, including sickle cell anemia, which is a genetically inherited disorder, particularly confined among certain regions of the country and among certain groups, including tribal groups, who constitute some of the most vulnerable sections of the population. Sickle cell anemia is extremely disabling. It lowers life expectancy, it's a disability, and to that extent it's a very important step. However, the blueprint for a sickle cell elimination is a next stage detail that's awaited. But in terms of commitment, it's an extremely important commitment, as the commitment for the Anemia Mukt Bharat is, on which the progress is yet to be ascertained. But again, the commitment is absolutely certain.
Government has also announced that they will work on this mission with the help of state government. They will collaborate with the state government. They will allocate 60% fund from the central government and 40% will be borne by the state government. They will screen around 40 crore people from 0 to 40, they screen about 7 crore people from 0 to 40 years. And if you see in these tribal areas, there is one child born in 86 births, they are suffering from sickle cell anemia. I think this is one of the greatest move to eliminate sickle cell anemia.
Absolutely. So with a lot of prioritization and commitment, we were able to eradicate polio, and hopefully this is one mission that the government has launched. Now the key will lie, of course, in how effectively it is implemented, as Dr. Dasgupta suggested. So we'll have to wait a little more to see how the implementation is actually taking shape. But coming back to the area of research, and this is one question that I would like to ask you, Dr. Gupta. The onus is always on what the government did and what the government fell short of doing. How can we expect the private sector to play a major role when it comes to research? Because globally, when we see at all of these advanced nations whose healthcare sector is remarkable and doing well, of course, COVID was something that brought everyone to its knees. But largely, for a strong and efficient healthcare sector enabled by efficient research, it's a public-private collaboration. So the private sector in our country has to also step up and contribute significantly towards the area of research.
I think you are absolutely correct. We have seen in the COVID also, if we were able to develop our indigenous vaccine, it was not for help for India, it has helped so many nations across the world.
Sure.
So research and development and innovation is one of the most important area in the healthcare, and we are now going to the AI, artificial intelligence and machine learning. I think government has already allocated around 3,000 crore for research, and they have given the opening for ICMR, so that private sector faculty and government sector faculty, those who are not allowed for research in this prestigious institute, now they can go and tie up with the ICMR also, they can do research also. Even government is now investing, and they have asked the private players to come up with that research in the R&D in the pharmaceutical sector also. They have now developing Center for Excellence in Pharmaceuticals also. So I think there is a lot of things can be done with the help of public-private partnerships in research also. And we have seen in the research in vaccination area, like we are one of the largest manufacturers of the vaccine in the world.
In fact, it has helped us, up our vaccine diplomacy also, so gaining recognition from a lot of countries who we sent our vaccines to. But Dr. Dasgupta, these were about what has been done, what announcements have been done, but what are the expectations and which are the areas where you think there have been, the government has clearly missed the target when it comes to reforming the healthcare sector? We've learned huge lessons from the COVID pandemic. It was a difficult time for all of us. But despite that, of course, allocation has not been significant enough as expected. But in terms of the other areas that health care professionals would have expected, and it's been a miss this time?
I think the government needs to keep health equity clearly in its vision. It's ultimately about reducing health inequities. All of these are actually processes. Whatever we are constructing, whatever we are putting into the digital architecture and so on and so forth. But the ultimate test is how much of health inequities we are able to reduce. Even in terms of universal health coverage by 2030, the ultimate test is how much of out-of-pocket expenditure we are able to reduce, how much burden we are able to reduce. That really is the test of the vision of any government, for that matter. What I think still needs to be addressed is research is not just labs or hospitals. There is a whole range of social research that goes into health, social sciences in health, health equity research, health systems research. These are areas which need more attention and which in turn will actually enable the technology to be harnessed in a more equitable manner.
Absolutely. So demography may be an advantage for us, but only a healthy population can contribute to a healthy growth of any country. And as the Prime Minister has envisioned, we hope India will become a developed country by 2047 in the next 25 years. But for that, it's important for our population to remain healthy. And the focus has to be on, as Dr. Dasgupta said, to ensure that these health inequities are taken care of well in time. That having been said, we'll have to wind up the program. Thank you to both our panelists for joining us on the program today, sharing your thoughts with us and our viewers. And to you viewers, thank you for your time. I'll see you same time next week now. Take good care of yourselves. Keep watching Sansad TV.